All right. Hello and welcome to today's webinar, Building a Better Digital Front Door, Phoebe Putney's Best Practices for Success. My name is JJ Lane. I'm an Associate Director of Market Development here at Phreesia, and I'll be moderating today's presentation. Today, we're going to shine a spotlight on Phoebe Putney and show how they're building a digital front door that enables a more convenient, streamlined experience that drives both staff efficiency and better patient satisfaction. So before we get started, I'd like to quickly share some housekeeping notes. You can submit questions at any time using the Q&A widget at the top left-hand corner, and I will ask as many questions as time allows. In the resource widget, you'll also find one-pagers that discuss our company, our valued health systems, and offerings for your digital front door. Additionally, we'll be sharing a white paper on healthcare's digital transformation and a case study about how Health First, a Florida-based health system, has streamlined their registration and access processes. If you have any technical difficulties, please click on the help widget. It has a question mark icon and covers any common issues you might encounter. Since it's always one of the most frequently asked questions, this session is being recorded and you'll receive a link by the end of the week for it. Great, now jumping into the agenda, today's session is going to start with introductions, followed by an overview of the digital front door and a discussion of the digital experience that patients have come to expect. Finally, we'll share some metrics about Phoebe's digital transformation and launch into a panel discussion with Q&A from our speakers. And great, now thrilled to introduce to you our speakers for today. Ginger NeSmith is a financial applications manager in the Information Systems Department at Phoebe Putney Health System in Georgia. She has successfully partnered with Phoebe's revenue and finance teams to successfully implement multiple applications and workflow initiatives. Phillip Wright II is currently the Interim Corporate Director of Patient Access for Phoebe Putney. And Phillip is a results-oriented, quality-driven healthcare professional with experience in both financial and operational management. Thanks for being here today, Phillip and Ginger.
Absolutely.
Thank you for having us.
Great. Thank you both. So a little bit of background on Phreesia. Phreesia is a SaaS technology company guided by our mission to create a better, more engaging healthcare experience for patients, providers, and staff. We have real-time integrations with all the leading EHRs and registration, scheduling, and billing systems. We are a publicly traded company on the New York Stock Exchange. We've been rated #1 in patient intake management by the research and insights firm KLAS for 4 years in a row. And our security and privacy efforts are recognized with industry-leading certifications. If you're interested in learning more about Phreesia, you can always request a consultation using the drop-down menu on the right-hand side of your screen, or you can visit us at phreesia.com. Perfect. So jumping into the presentation here, let's start with the definition of the digital front door. Your digital front door is made up of all of the technologies that facilitate the patient journey before, during, and after an episode of care. That can include anything from scheduling to registration and payments, through to post-visit surveys, and any patient recall or educational outreach you're doing. But for the digital front door to produce real operational, financial, and clinical results, all of those pieces have to work together. All those technologies you leverage need to integrate with each other and with your EHR, and the entire process has to look seamless to the patient. They shouldn't have to have multiple logins or download multiple apps. Now, thinking a little bit about looking into how patients expect a digital front door experience to look, wanted to share a few findings from a survey of around 4,000 patients that Phreesia conducted last year. These results offer some good insight into what patients have come to expect from the digital front door. We found that nearly 9 in 10 patients, the overwhelming majority, are comfortable using technology for their healthcare needs. That level of comfort extends to digital messaging with their doctor, online bookings, and rescheduling appointments. We saw that 80 to 90% of patients said they would use these tools in 2022 if they were available. About 2 in 5 patients also paid their medical bills online in the past 12 months, but many more of them, around 70%, said they would do so if it was available. We really need to make sure these tools are more readily available to meet rising consumer demands. Now, looking at peeling back the layers of your digital strategy, we've talked about the digital experience that patients expect, but how does that factor into your overall technology infrastructure and planning? We think it's really important to think about your technology strategy in different layers. So the EHR is first and foremost that clinical layer. It's incredibly important for clinical documentation, patient billing, clinician orders, and all those other internal processes essential for the provider workflow. It's also critical for your reimbursement workflows. It's really a tool designed for clinicians as well as staff in various operational departments. However, it's not always optimized for the patient. We believe that to provide that experience patients demand, you need to add a second layer, the experience layer. Really any patient-facing platform that engages patients more deeply in their care. This is what patients see as your digital front door. It's built to allow those patients access to registration, scheduling, payments, and more at the time and place, and more importantly, in the modalities that are convenient for them. And to ensure that patients really use this technology, we have to break down those barriers by using a solution that doesn't require a login or an app, and that seamlessly integrates into your existing systems. This isn't a replacement to the EHR, but think about it rather as a complement to it. By providing an exceptional digital experience, you can make the most out of that significant investment you make in your EHR and increase patient portal adoption and ongoing usage. Make sure patients are really retained into that system. Great, so I'm thrilled to talk to Ginger and Phillip about how Phoebe Putney has used Phreesia as part of their digital patient experience. And we want to run through a few metrics that highlight that success. So at Phoebe, 90% of patients check themselves in through digital intake, leading to better prepared patients and reducing patient wait times. When patients prepare for their appointment through Phreesia, we find that they're more likely to show up. The no-show rate at Phoebe facilities using Phreesia is only 4%. Also, we're seeing that 94% of patients are satisfied with that intake experience. And staff are happy as well because they're saving over 5 minutes of time per patient that checked in through Phreesia. Finally, 75,000 consent forms are completed digitally each month, and nearly 1 out of 2 intake sessions are completed on mobile devices, allowing staff to spend more time dealing with those complicated patients that still require more manual support. So Phillip, do you want to provide a little additional context on these stats?
Yeah, these stats look to be quite accurate. Phreesia helps us be able to push out the patients quicker and push them through the area faster. And these numbers indicate that we're doing just that.
Great. Fantastic. So let's talk a little bit about some of the other ways that Phoebe is taking burden off of staff. So Phoebe's online experience, including registration, scheduling, and chat, has helped the organization eliminate about 2,700 phone calls per month. How are they doing that? Each month they send 20,000 automated appointment reminders, 1,700 two-way text messages, and 10,000 check-in reminders. So all of these automated notifications are designed to ensure patients are engaged, prepared, and then show up really on time. Ginger, would love to hear from you a little bit more about what you're seeing on the ground here at Phoebe, and in particular, some of the nuance you might see across different care settings.
I love this slide a little bit because that first square, we're talking about automated appointment reminders being sent out to the students, to the patients. I mean, that's great. We have been doing that in healthcare for several years, but I mean, the great thing about a doorway is it works both ways, right? So we're getting a message out, but how do we get back what we need from the patients? How do you really have engagement if they can't communicate back with you? And I think that's where that two-way text message really comes into play. Their ability to engage a little bit. Does the appointment time still work for me? Is my information correct when I'm going through that pre-registration process? Has my insurance changed? Do I need to speak to somebody now because I need to figure out how I'm going to cover this expense? That's when you start really kind of getting to that next level. And that's when you really start to see the patient getting really involved in their care.
Absolutely. That's great. Love to see that back and forth as well. Phillip, anything to add?
Yes, just elaborating on the two-way text messaging. We actually use this feature in our surgery care area where they do surgeries. We communicate with the patient prior to them coming in to set up their PAT appointment, to come in before their surgery, to get their lab work done and things like that. So we're able to communicate back and forth with the patient, whereas instead of having to call each patient and spending that much more time on the phone with the patient, we can handle several patients at one time by asking them when they want to come in for their appointment. So we're able to work more efficiently with these text messages as well.
Absolutely. So that's great to hear. I think it's a good example of seeing digital tools as an extension of your care team to guide patients through those really complicated pre-visit milestones, especially around the surgical workflow. That's great.
We also have an example from the EC as well.
Great. Let's jump into it. I'd love to hear about that.
So we actually didn't think that we would be able to use the text messaging feature in the EC, but we found a reason to use it. If Phoebe will find a way to do anything.
That's great. Let's unpack that. What are you seeing in those emergency workflows?
So in the emergency room, we have a tracker board in the EC, and the nurses tend to update the tracker board and let us know where the patients are. So that way, when we're ready to register the patient in the room, we don't go to the room, without the patient being in there.
Right.
So sometimes the nurses
inconvenient time.
Right. Or if the doctor's in there, during that time frame. So we tend to look at the tracker board. Well, if the tracker board hasn't necessarily been updated, at that point, we may go in the room and then we don't know exactly, where the patient has been taken to. So we'll communicate with the patient and say, where are you currently? And the patient will let us know, they took me to get an MRI done or a CT or whatever the case may be. And that way we know about how long it takes the patient to get back to the room from the MRI or CT, and we can go in and get the updated information that we need later on.
That's great. Fantastic use case for that. Great to hear it. Awesome. So we already started, but let's jump in with some additional questions. Phillip, let's start with you. So would love to hear a little bit more about Phoebe and the patients that you serve. So can you tell us a little bit more about the reach of the system, the structure of your access department, and any details you want to share about what your patient population looks like?
So we currently have 3 main facilities. We have one located in Americus, Georgia, here in Albany, Georgia, which is our main campus, and then we have one in Sylvester, Georgia as well. Which Sylvester and Americus are 2 smaller facilities, but they're part of Phoebe nonetheless. So we do see patients from those 3 counties, but we do see patients from other counties as well outside of those 3. A lot of other counties, actually. We've even had patients come from Nigeria, actually, to our cancer center here at Phoebe. So we get patients from all over here at Phoebe.
That's great. And so I imagine having patients coming from all over, coming across multiple care settings we talked about earlier, it must be really important to have easy to use, easy to access tools that are that can be used by all those different patients, right? I guess would love to learn a little bit more about what your access department looks like. Are all patients coming through like a central registration group, or is it kind of managed at the care setting level? What does that look like?
No, we are not coming through one central location. That would be great, but that is not the case. Just here on the main campus, we have over 10 different locations that we see patients in, including our emergency department that we talked about earlier, surgery care, our main admitting area, which sees roughly 5 or 6 different procedures within itself in that main admitting area. So here on the main campus alone, there are several different locations that we utilize. We do have another location across town over in Meredith, where we see about 5 or 6 different modalities over there as well. So we're spread very thin, honestly. So Phreesia was actually very beneficial to us in the regard of it allows us to get patients seen before they even come in, and they're taken care of. They've signed their consents and everything before they come in. So that way it's a quicker process when they come in. When we have call outs in the areas, and we can't necessarily find somebody to cover that shift, it allows us to better be able to manage the patient throughput, because most of the patients might be completed already for that day. So staffing wise, it has really, really helped us.
That is a fantastic application. Seeing where there are staffing shortages in the near term, how do you communicate that to patients at scale quickly, and make sure you're kind of getting the right patients in and helping to manage those workflows where possible. That's great. So Ginger, I think thinking a little bit more about what the digital front door means to you and means to Phoebe, would love to learn a little bit more about kind of how your digital experience has evolved over time. And just kind of what about the Phoebe experience makes you feel like you're offering a true competitive digital front door solution to your patients?
Well, like I mentioned before, people have been utilizing digital or text messaging for several years now. Obviously, with the pandemic, it became more imperative. And we had to get a little bit smarter about how we utilize the tools. It's been great having the interactive communication with the patients where they can get back to us, because even though we call it the digital front door, is it really a front door anymore? I mean, I feel like we have a digital living room, we have a digital side porch, we have a digital back porch. I mean, everything has the possibility of going in that direction, especially as telemedicine starts to just broaden every opportunity out there. So keeping that in mind and trying to be smart with it, using it where it makes sense, but then understanding that it's just one of many tools. It doesn't replace anything. You still need to have that touch and that interaction. You're still always going to have registration. You're always going to have an intake lobby, but being able to add it to your toolkit to be able to start engaging the patient sooner, communicating with them sooner and earlier, so that when they get there, they're ready to hit the ground running. Like Phillip indicated, they've already got their stuff ready to roll. They're just checking in, maybe getting an armband, maybe getting directions about where they're heading in the building. It's just such a faster experience and more streamlined. I'm excited to see us continue to move in this direction. I mean, we still have some areas where we want to continue to deploy Phreesia. And then we also have a lot of opportunities within the tool that we're continuing to kind of explore. Things like utilizing the health campaigns where we're communicating upcoming reminders. Don't forget your annual screening. Don't forget, for ladies over a certain age, don't forget to schedule your next mammogram. Just things that help us to kind of keep a little a touch with the patient here and there. We're here and we want to help you on the journey. But like we've always talked about, no one's really perfect and no one's really ever finished with what they're doing. So it's exciting as we continue to kind of get there.
Absolutely. You said two things that I think are really important there. One, we hear this from a lot of our clients. It's not that you're going to be able to reach every patient with this digital front door, but hopefully you can reach as many as possible, and then dedicate more staff time to those patients that are maybe a little more complicated, need more of that manual intervention. And I think that's great. And then to your point, it's an evolving process. You build upon it over time, and it's not going to be perfect, but you deploy to additional use cases as the needs of the organization, the patient population need it.
Absolutely. I think something you said earlier kind of stuck out to me. Like, you're always working for better. We're always trying to better meet the needs of the patient. We're always trying to improve the communication that we're able to interact with them. But like we said, every patient's different. Every need is different. So it's just great having another tool to help you get there.
Absolutely. Absolutely. So Phillip, we talked a little bit about the success metrics earlier in the presentation, but we'd love to dive into that more. Just anything else that you'd want to offer up around how having these self-service tools is enabling Phoebe to deliver on some of its strategic goals around patient access?
Well, one thing that I talked about earlier was throughput. That's one thing that we've really been trying to manage is the throughput of the patient. Going from taking 15 to 20 minutes per registration when it's a manual registration to, maybe, 7 to 10 minutes utilizing Phreesia. And that's if they haven't already used the tool before they came in. If they've used the tool before they came in, like Ginger mentioned earlier, it's just a simple, I'm going to print your armband, I'm going to print your labels, check you in, push you down to the bottom, and, send you on your merry way to the area. So it's a lot quicker of a process. But so that's one metric. It's even helping us actually meet our collection goal. We started utilizing the payment feature in Phreesia in one of the areas, and so we are seeing some payments come through in regards to utilizing it in Phreesia. So collection-wise, we are actually seeing an increase there as well.
That's
Which who
great.
doesn't want to know what they're going to be expected to
Yeah.
pay before they show up? I mean, again, it's such a huge help to be able to prepare the patient before they actually walk in the door.
Yeah, absolutely. I mean, Philip, a lot of those metrics we talked about earlier, come down to there's a lot of cost savings in being able to use these self-service features. But I love what you're mentioning as well around increasing throughput, making sure that you're utilizing provider, staff, machinery, resources to their fullest extent, and keeping those schedules full. So that's great to hear. Ginger, you had mentioned that your digital front door, Phreesia, helping to break down some barriers that your patients are having to getting more engaged in their care. Curious, like what barriers do your patients typically face, and how are you helping those patients overcome them?
So I think there's kind of one area in particular that Phreesia is especially beneficial. And I know I keep harping on communication, but it's just that ability to reach out to the patient where they are. And let's be honest, everyone's in a pretty busy place these days. So not having to leave a voicemail, not having to have a phone conversation at what might be a really inopportune time, but getting that text message. I love the idea of email, but let's be honest, email is already starting to sort of go that way of postal mail. Like people are moving more and more into the text direction. But to be able to act on it when the timing is a little more convenient for them, when they've had the opportunity to consider it, or they actually have a moment to sit down and respond, that's a huge benefit, especially in a time where people are oftentimes transitioning. It's not just their own care that they're worried about. They're trying to deal with appointments or appointment reminders for an aging loved one, or they're managing appointments and reminders for children and other dependents. So having to be able to keep up with all of that and having the ability to act on it at a time that's convenient for them, I think it's hugely beneficial.
That's great. Yeah, absolutely. Love to hear that. I think the ease of use, the accessibility of digital tools is such an important part of making sure that patients feel empowered, a little bit more active in their care. So fantastic to hear. Ginger, one other question for you. Since you've been so heavily involved in implementing this digital front door strategy, what best practices would you maybe want to share around that process of implementing and then trying to optimize those services?
Well, one thing that we've found here is don't try to boil the ocean. We talked about it. Yeah, I would not say we have a perfect solution just yet, but each week, each month, we're looking to get better and to improve and expand upon what we're doing. If you're trying to do it all in one go, it's really difficult to have a smooth, successful experience. And again, this is patient facing. You only have one chance to make that first impression. So, kind of ease your patients into it, get them used to changes as you go along, ease your staff into it, get them used to changes as you go along. I will say one of the things that we've kind of come across is, keep your data in mind. If you were not previously big into texting with patients, double check. Have you made it a priority to collect cell phone numbers, or do you have other phone numbers? Have you made it a priority to notate that they're mobile numbers? Just things like that you might need to go through and kind of prepare for in advance of utilizing a tool like this. If you have multiple EHR platforms, which do you feel is going to have the most recent number? I mean, in an acute setting, you may not be the one that is seeing the patient most frequently, but if you have a clinic setting with a separate EHR, maybe, with well visits and check-ins, you might get a more current number on that side. So how do you utilize and leverage those so that you can get the best number and the best information?
Absolutely. That's great. We work with a lot of clients who are leveraging multiple EHRs across acute care versus their clinic settings, maybe clinics that they've brought on through acquisition or on a legacy system. you're right, being able to integrate all of that and deliver on as consistent an experience for staff and patients as possible, kind of throughout that experience is really
Yes.
important. So,
And with that in mind, I would definitely recommend always keep the patient in mind as you're going through this process, and be aware of everyone else that's on that digital landscape with you at your facility. You may be sending patient surveys, you may be sending other provider notifications. Just keep it in mind, because you don't want to start to have fatigue on the part of the patient where they're just tired of getting all of this messaging from you. So, be aware, because the frequency with which they're getting messaged by your health system is not limited to what you're doing. There are always other groups that are out there trying to engage in similar ways.
absolutely. Yeah, I love the emphasis on being really focused on the most important things. More is not necessarily better. And I think prioritizing applications that are easier to roll out and that deliver on the highest value for your group, it makes a lot of sense. Philip, anything you'd maybe want to add to the implementation experience, Phoebe?
Yes, actually. I would also suggest to strategically map out which area you would want to go live in first. Because what happens with that is word of mouth spreads among the staff. So if the first area that you implemented didn't go well, the rest of the hospital environment will know about it soon enough. If it went well, word of mouth will spread, and you will have easier implementation in the other areas after that. So, like Ginger said, don't boil the ocean. I love Ginger's little saying.
Gingerisms.
There you go. I like that one, Ginger. So don't boil the ocean. Don't try and tackle everything at one time. Strategically map it out and go one step at a time. We've been implementing Phreesia for almost a year and a half now across our entire campus. So we have strategically mapped it out, and it's been successful. Every implementation has gotten simpler and simpler for us. I feel. Ginger may feel differently, but I feel it has gotten simpler and simpler. Even though the staff in that particular area may not know what's going on or have seen Phreesia, the management team within that area has seen it, and so it's easier for them to explain things to the staff because we've been there, done that in a sense. Also, breaking down your process pre-Phreesia and post-Phreesia is very key to the success of any area. So your process may look one way pre-Phreesia, but you have to imagine what it's going to look like post-Phreesia before you even go live. So I actually sat down with each one of my team leaders each time that we went live to come up with a process of how we thought it may look with Phreesia. And so we gave the staff members different tasks based on how we thought it may look. And that worked out very well. If we had not done that, it would have been a disaster, honestly. Not from Phreesia's perspective, but things were just different once we went live. And we had to come to that realization very quickly.
Absolutely. You highlight a really important area, where it's, these digital technologies may integrate seamlessly into your workflows. That might be a goal of the organization, but it might also be an opportunity to optimize your workflows, do something a little bit different that is better for your staff, better for your patients. It's important to address that early on and make sure that you're, keeping that at the forefront throughout that process. And that's a good lead into our last question here. What advice do you have for other organizations who are maybe earlier on in their process, who are at the beginning stages of building out their digital front door strategy? Any thoughts on kind of partnership best practices or what these groups should look out for? Tee that up to either one of you, whoever wants to take it.
You want to go first, Philip?
I think it's mainly what we just talked about.
Yeah,
actually. And just breaking down your process. Making sure you have enough staff in the area to do things that you need to do. Make sure you have the equipment in the area that you need. That is very key. Once you look at the process, post Phreesia, making sure that the equipment in the area is what you need, because it takes a while to get equipment in the area. So you want to make sure that you have the right equipment, prior to the go live.
I think some of what Philip is referring to is probably wireless coverage. I think we discovered when in one of our registration areas, we did not have the best of cell coverage. So we were putting up signage for how to connect to the Wi-Fi, how to, if you were going to utilize the mobile pre-registration on your phone, making sure you have enough of the tablets, right, Philip? And then also, if you're going to have, I think you have staff that rounds in some of those areas, right? In case patients have any problems while they're trying to do the registration on the tablet.
Right.
So they're utilizing different tablets or WorkPad devices to be able to kind of move them down within the Phreesia application, or if need be, then you pivot and you get them to a full registration with a registrar as well.
Yeah, exactly. Coming back to what we talked about earlier, you need to be able to have those mobile workflows for patients when available, and if not, have those kind of safety nets of pads, kiosks, those things that make that process a little bit easier. So
yeah,
great
you're never going to be 100%, right? I mean, you're going to have people that have vision needs that you need to account for. We're a hospital. You're going to have correctional facilities that are bringing folks that are going to need. We do not utilize Phreesia for our trauma patients. I mean, you're never going to really be 100%, but like we mentioned before, it's another tool just for helping to ease the intake for as many patients as you can, and to help Phillip's staff to be able to better focus and prioritize what they're doing and where they need to they need to engage and help.
Yeah, and I'm sorry. I was going to say, just understanding the tool itself is very beneficial, because if you don't understand the tool, you don't know how to use it, you don't know all of the different applications that are within the tool that you can utilize for your staff. We found out there were several different things within the tool of Phreesia itself that allowed us to better serve our patients, like the text messaging function, the appointments hub for the surgery care patients, things like that. So and there's still more that we can learn, about Phreesia at the end of the day. We've gone live over a year and a half ago, but we're still learning.
We're always finding we're always finding something new we can do. And I think we always joke, that we'll come to Phreesia with some pretty crazy ideas sometimes, and they haven't. Philip is the only person they've told no so far. And it was just the one time, right, Philip? But
I don't even remember what it was for at this point, Ginger.
Well, Philip, we'll have to follow up on that point. Ginger, you had said something in a prior conversation that really stuck out to me. It was along these lines. You said that one of the most important things in building out this digital front door is having a partner who's along for the ride, like you're talking about. What in that kind of technology partner do you look for? Is it specific capabilities? Is it a willingness to kind of collaborate and listen to your needs? What do you look for from that partnership perspective?
Yes and yes. I think, like Philip said, we're always learning something new about Phreesia. It's not that, you guys aren't communicating with us, but, sometimes it's a little bit of the fire hose. There's so much there that's available to us. So we kind of have to pick and choose and focus and really hone in on that. And then we move on to something else. It's just really tremendous having a partner that sits there and thinks through our workflows and our processes with us, hears us out when we have those ideas. And while they may not be able to accommodate it the way we first kind of envisioned it working, they will work with us to find a way to make it happen. And that's really great, because you feel like they're invested in the success of the tool just like we are.
Fantastic. I think that's a great point to end on. Phillip, Ginger, any other comments that you'd want to bring up?
No, sir.
No.
Perfect. Well, we thank you so much. So that's all the time we've got today. If we didn't get to your question in the chat, or if you have any other questions about Phreesia, please don't hesitate to reach out. You can request a consultation using the form on the right-hand side of your screen. We'd love to be in touch. So Ginger, Philip, thanks again for serving as our panelists and for sharing such great insights. We really appreciate it. Have a great day, everyone.
Thanks.